Hi, I'm Dr. Santhosh Bethur. I'm lead consultant at Aster RV Hospital, JP Nagar, Bangalore. September month is dedicated as a prostate cancer awareness month. Across the globe, it is dedicated to making people aware of the possibility of prostate cancer in men, what are the symptoms, how to diagnose, and what are the treatment options available for the patients. As we can see in India, of late the number of prostate cancers are increasing. One possibility because probability of increased in diagnostic procedures, diagnostic scans available, which was not available few years back or few decades back. Another thing is the awareness from the patient side. Third thing, the longevity of patients are increasing, or in generally the life expectancy is increasing since it's a disease of old age. The prostate cancer is typically seen in age group of 60 years and above. So as the people live for longer years, we will see more and more prostate cancers. Prostate cancer in most commonly presents in an asymptomatic way. Asymptomatic means people will not have any symptoms. We'll identify when we screen for the prostate. In generally most patients, they undergo a routine health checkup, and one of the blood tests, we call it as serum PSA. It's a simple blood workup. If it is included in those tests, most people will come to know about the possibility of prostate cancer. The level of PSA, if it is high, we will screen this patient and we will subject them to further tests. Having said that, yes, some patients will come with some urinary symptoms like any difficulty in passing urine, pain while passing urine, blood in the urine, and in advanced stages, patients may come with typical bone pains, backache, loss of weight, and loss of appetite. Whenever we see either asymptomatic or symptomatic, we will subject these patients for some form of scanning. It's usually an MRI of the prostate or sometimes called PET scan. It's very typically called a PSMA PET scan. If the suspicion of cancer is high, then we have to confirm the diagnosis by doing a biopsy, which is typically done in an OPD basis. If patient turns out to be a prostate cancer, then we will offer them various treatment options. The treatment depends on the stage of the disease, the age of the patient, and also the life expectancy of the patient. Because if the treatment is more toxic to the patient than the disease itself, in those cases we don't offer this treatment. If patient is benefiting from the treatment, then only we subject them for these treatment options. In the early stage, we manage them with a surgical procedure. We do robotic surgery to remove the entire prostate with the surrounding glands like seminal vesicles and some lymph nodes. Alternative treatment options include radiotherapy. In those patients who are not candidates for surgical treatment or radiation, then there is something called hormonal treatments. So most patients are treatable. If any of the symptoms I have talked about in my last few minutes, if you experience any of these symptoms, you can further consult me at Aster RV Hospital in JP Nagar.